So there's a lot of different panels out there, correct? So can you break down some of the most important blood tests that you typically will run on patients?
Yeah, so I do a complete blood count and a complete metabolic panel, which assesses, blood counts, electrolytes, kidney function, liver function. That's pretty much standard, I would say, a routine lab that most of your providers are going to check. I do an extensive thyroid panel. So a lot of the time my patient comes in with, oh, I have a TSH. Well, that's not really a reflection of your thyroid. So I delve into the thyroid. What's the reverse T3? What's the free T3? What's the free T4? Do you have antibodies that are attacking your thyroid gland? I mean, there's way more to the picture, as Hashimoto's is the number one cause of hypothyroidism. So I catch a lot of those actually. Inflammatory markers, I specifically look at the high sensitivity CRP, which is specific to the heart. And I'm able to find those patients that are more at risk for cardiovascular events, which is our number one cause of death still. And these patients have no idea that they have this elevation in this level. So it's pretty astounding to be able to not only educate them, but tell them what I can do to correct that. I look at, iron storages, because you can't fix the thyroid until your iron levels are optimized. I look at vitamin D, vitamin B. I look at more extensive lipid panels. So yeah, you have your cholesterol, your HDLs, LDLs. I actually am also incorporating in what's now called an LP little a. It's actually a genetic mutation that's found in about 20% of the population. And it's again shows that these patients that have this genetic variant or polymorphism is at increased risk for stroke, heart disease, heart attack, which is quite a significant group of people. So that's just some. And then obviously I check testosterone, estrogen levels, sex hormone binding globulin, which is important to know when you're dealing with hormones. So that's the majority of what I draw. Of course, if a patient comes in with other needs, I can draw pretty much anything and everything. I have a lot of patients with mold exposure, Lyme's disease, questions about, inflammation markers. So I can always add those in as needed too.